April 11th through 17th is National Minority Cancer Awareness Week. It's a time to raise attention to some of the factors that cause increased cancer among certain ethnic groups. Increased rates of cancer among minorities isn't solely the fault of genetics. African Americans and Hispanics, for example, have higher instances of poverty among that population. This leads to fewer of them having health insurance and access to medical care that could prevent or cure the condition. The Office of Women's Health maintains that due to this, African American women are the most likely to die from breast cancer, largely due to late detection, which decreases their treatment options. But of course, genetics plays a role as well, particularly with family history. With this in mind, mammograms are crucial to ensure breast cancer is detected early in minority women to increase their chances of survival. Florida Hospital Waterman's mammography team tells us about how they test and what they're looking for.
The way we advise patients to get mammograms is to get a baseline mammogram at the age of 35 and then to get a mammogram from age 40 every year without fail. Despite what other people have said and some other studies, this is proven by both the American College of Radiology as well as the cancer institutes around the world. And actually, women who are high risk even can get a mammogram at age 30. There is a cancer gene known as the breast cancer gene 1 and 2, short form being BRCA1 and BRCA2. Those patients should get mammograms starting at the age of 30 and then 35 and then every year from 40 onwards for sure. Some people also promote an MRI at the age of 35 too, with contrast to help us detect some of those earlier lesions if possible. It's a genetic DNA test that needs to be performed. And people who should get it done are people who have had at least 3 women family members who have had breast cancer at a young age, meaning like a mom, an aunt, or grandmother, all on the mom side, the woman's side, not the paternal side. That's the key. But what happens is the breast cancer genetic itself only affects about 5 to 10%, up to 25% in some populations. Like the Ashkenazi Jews, they have a very high incidence of breast cancer. So theirs is more genetic. Whereas people, sometimes they say, oh, my mom had it, I should, they start panicking a little bit. It's not necessarily true. I mean, unfortunately, it happens in 1 in 8 women anyway. But it's not always genetic. Then you can see, your physicians and they can get appropriate genetic counseling.
Florida Hospital Waterman has been designated a breast imaging center of excellence by the American College of Radiology. If you'd like more information about their digital mammography services or to schedule an appointment, follow the Minority Breast Cancer story link on our homepage at yourhometownhealth.com. We'd also like to add that Adventist Health System, which includes Florida Hospital Waterman, has been named to Becker's Hospital Review's 2017 list of the 150 great places to work in healthcare. The list features both healthcare provider organizations and other healthcare-specific companies. The 150 Great Places to Work in Healthcare distinction recognizes organizations for their commitment to fulfilling missions, creating outstanding cultures, and offering competitive benefits to their employees.